Welcome to this video on pain and top 10 ways to manage pain by AidBuy. In this video, we'll be discussing pain, types of pain management, its importance, complications, and top 10 ways to manage pain. Pain is a subjective, unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. It is a complex phenomenon that involves both physiological and psychological factors. According to a study published in the Journal of Pain, untreated pain costs the U.S. economy between $560 billion and $635 billion annually. Additionally, the Centers for Disease Control and Prevention, CDC, reports that over 50 million Americans have chronic pain, with an estimated $300 billion in medical expenses and lost productivity annually. Pain management is crucial because untreated pain can lead to many complications, such as depression, anxiety, sleep disorders, and decreased physical activity. According to the World Health Organization, 1 in 10 people worldwide suffer from chronic pain, and this number increases to 1 in 3 for people over 65. Untreated pain can also affect a person's ability to work, participate in daily activities, and enjoy their hobbies. Additionally, untreated pain can lead to opioid addiction. In the United States, more than 130 people die every day from an opioid overdose. Therefore, it is essential to treat pain effectively while avoiding overuse of opioids. Anatomy of pain. The transmission of pain involves a complex network of structures within the nervous system. Here's an overview of the anatomy of pain transmission. Peripheral nervous system, PNS. Nociceptors. Specialized sensory receptors called nociceptors are found throughout the body, especially in the skin, joints, and internal organs. Nociceptors detect noxious stimuli, such as extreme temperatures, mechanical pressure, or chemicals released by damaged tissues. Afferent nerve fibers. A-delta fibers, fast-conducting, myelinated. A-delta fibers transmit sharp, well-localized pain signals. These fibers are responsible for the initial, acute pain perception. C fibers, slower, unmyelinated. C fibers transmit dull, more diffuse pain signals. They are associated with a longer-lasting, persistent pain sensation. Dorsal root ganglia, DRG. Cell bodies of nociceptors. Nociceptor cell bodies are located in clusters called dorsal root ganglia, situated along the spinal cord. These ganglia serve as relay stations for pain signals entering the spinal cord. Spinal cord, dorsal horn. Nociceptive signals enter the spinal cord and synapse in the dorsal horn. In this region, neurotransmitters are released, transmitting the pain signal to the next set of neurons, substantia gelatinosa. This is a specific layer within the dorsal horn, where modulation of pain signals can occur. Inhibitory and excitatory neurons in this region play a role in regulating the intensity of the pain signal. Ascending pathways. Spinothalamic tract. After synapsing in the spinal cord, pain signals ascend via the spinothalamic tract, crossing over to the opposite side of the spinal cord. This tract carries information about the location and intensity of the pain signal. Dorsal column, medial lemniscus pathway. This pathway carries information related to the precise location and fine touch. It also plays a role in the transmission of some pain signals. Brainstem, medulla, and pons. The ascending pain signals reach the medulla and pons, where further processing occurs. These structures are involved in regulating the overall sensory experience and coordinating responses to pain. Thalamus, relay station. The thalamus receives pain signals and relays them to various parts of the brain, including the somatosensory cortex and limbic system. This helps create the sensory and emotional aspects of the pain experience. Sensory cortex. The somatosensory cortex interprets the location and intensity of the pain signal. Limbic system. Emotional aspects of pain are processed in the limbic system, influencing the overall perception of pain. Understanding the anatomy of pain transmission helps in developing targeted interventions for pain management. Medications, physical therapies, and psychological approaches can be tailored to different stages of the pain pathway to alleviate discomfort and improve the overall quality of life for individuals experiencing pain. Physiology of pain. Pain is a complex physiological process involving the nervous system, and it serves as a protective mechanism that alerts the body to potential harm. The physiology of pain includes various stages and components. Transduction. Initiation of the pain signal. Pain begins with the activation of specialized nerve endings called nociceptors. These receptors respond to potentially damaging stimuli, such as heat, pressure, or chemicals released from damaged tissues. Transmission. Propagation of the signal. Once activated, nociceptors generate electrical signals, action potentials, that travel along nerve fibers towards the spinal cord. These signals are transmitted by different types of nerve fibers, including A-delta fibers, sharp, localized pain, and C fibers, dull, more diffuse pain. Modulation, amplification, or suppression. In the spinal cord, pain signals can be modulated. This modulation involves the release of neurotransmitters that either amplify or suppress the pain signal. Descending pathways from the brain also influence this modulation. Perception, conscious awareness. The brain receives and interprets the signals from the nociceptors. This is the stage where an individual becomes consciously aware of pain. Perception involves various brain regions, including the somatosensory cortex and the limbic system, which is associated with emotions. Integration. Emotional and cognitive aspects. Pain is not merely a sensory experience, it also involves emotional and cognitive components. The brain integrates information about the pain's location, intensity, and emotional significance, influencing the overall experience. Inhibition, endogenous pain. Modulation. The body has its own pain inhibitory mechanisms. Endorphins and enkephalins, which are endogenous opioids, can be released in response to pain, dampening the perception of pain. This inhibition can occur at various levels of the nervous system. Chronic pain changes. Neuroplasticity. In chronic pain conditions, there can be changes in the nervous system known as neuroplasticity. This involves alterations in the structure and function of neurons, contributing to persistent pain even after the initial cause of pain has been resolved. Descending pain. Inhibition system. The descending pain inhibition system is a complex network within the nervous system that modulates or inhibits the transmission of pain signals. This system involves pathways that originate in the brain and send signals down the spinal cord to regulate the perception of pain. The primary goal of the descending pain inhibition system is to dampen or block pain signals, providing a form of endogenous pain control. Here are key components and mechanisms involved in the descending pain inhibition system. Brain regions involved. Periaqueductal, gray, located in the midbrain. The PAG is a key region that plays a central role in the descending pain modulation. It receives input from various brain areas, including the cortex and limbic system. Rostral ventromedial medulla. The RVMM, also known as the bulbospinal region, is another critical brain area involved in the descending pain modulation. It sends inhibitory signals to the dorsal horn of the spinal cord. Endogenous opioids, release of endorphins and enkephalins. The descending pain inhibition system involves the release of endogenous opioids such as endorphins and enkephalins within the PAG and RVM. These substances act on specific receptors in the spinal cord to inhibit the transmission of pain signals. Descending pathways, spinal cord modulation. The descending pain pathways from the brain send signals to the dorsal horn of the spinal cord, where incoming pain signals are processed. The release of neurotransmitters, including gamma-aminobutyric acid, GABA, and serotonin, inhibits the transmission of pain signals. Gate control theory. Interaction with gate control system. The descending pain inhibition system interacts with the gate control system, which is a theory proposing that non-painful input can close the gates to painful input at the spinal cord level. The descending pathways play a role in influencing this gate control mechanism. Stress-induced analgesia. Activation during stress. Stressful situations can activate the descending pain inhibition system, leading to stress-induced analgesia. The body's natural response to stress may involve a temporary reduction in pain perception. Understanding the descending pain inhibition system is crucial for developing strategies to enhance endogenous pain control. Approaches such as mindfulness, meditation, and certain forms of physical activity may activate this system, providing non-pharmacological means of pain management. Additionally, medications that target endogenous opioids or modulate neurotransmitters involved in descending pathways can be used to enhance pain inhibition. Understanding the physiology of pain helps in developing effective pain management strategies. Medications, physical therapy, psychological interventions, and other treatments target different stages of the pain pathway to alleviate discomfort and improve overall well-being. Chronic pain conditions may require a multidisciplinary approach, considering both the physical and psychological aspects of pain. Effective pain management. Medication management. Consult a healthcare professional. See a doctor who can assess your pain, provide a diagnosis, and recommend appropriate medications. Follow prescription guidelines. Take medications as prescribed, adhering to recommended dosages and schedules. Communicate with your healthcare provider. Report any side effects or concerns promptly to your doctor. Physical therapy. Assessment and personalized plan. A physical therapist will evaluate your condition and design a customized exercise program. Strengthening and flexibility. Targeted exercises help strengthen muscles, improve flexibility, and enhance overall physical function. Education. Learn proper body mechanics and techniques to prevent further injury and manage pain. Hot and cold therapy. Heat application. Applying heat helps increase blood flow, relax muscles, and alleviate stiffness. Hot packs, warm towels, or warm baths can be effective. Cold application. Cold therapy reduces inflammation and numbs the area, helping to manage acute pain. Use ice packs or cold compresses, but avoid applying directly to the skin. Exercise and movement. Low-impact activities. Choose exercises that are gentle on the joints, such as swimming, walking, or cycling. Consistency. Regular exercise is essential for maintaining overall health and managing chronic pain. Consultation with a healthcare provider. Before starting a new exercise regimen, consult with your healthcare team to ensure it is safe and suitable for your condition. Mind-body techniques. Deep breathing. Practice slow, deep breaths to promote relaxation and reduce stress. Meditation. Mindful meditation helps shift focus away from pain and promotes a sense of calm. Yoga. Combining gentle movement with mindfulness. Yoga can enhance flexibility and reduce muscle tension. Massage and body work. Massage therapy. Professional massage can help relax tense muscles and improve circulation. Acupuncture. Traditional Chinese medicine technique involving the insertion of thin needles into specific points on the body to alleviate pain. Chiropractic care. Manipulation of the spine to improve alignment and reduce pain. Cognitive behavioral therapy, CBT. Identify negative thought patterns. Work with a therapist to recognize and challenge negative thoughts associated with pain. Coping strategies. Develop effective coping mechanisms to manage pain and improve overall well-being. Goal setting. Collaborate with your therapist to set realistic goals for pain management and functional improvement. Supportive devices, braces, and supports. These devices provide stability and can alleviate pain by reducing strain on affected areas. Ergonomic modifications, adjusting workstations or using ergonomic tools, can help prevent exacerbation of pain during daily activities. Maintain a healthy lifestyle. Adequate sleep. Ensure you get enough restorative sleep to support the body's healing processes. Balanced diet. Consume a diet rich in nutrients, including anti-inflammatory foods such as fruits, vegetables, and omega-3 fatty acids. Social support and counseling. Emotional support. Connect with friends, family, or support groups to share experiences and receive emotional support. Counseling or psychotherapy. Seek professional help to address the emotional impact of chronic pain, manage stress, and develop coping strategies. Remember, these strategies may need to be tailored to your specific situation, and it's crucial to work closely with healthcare professionals to create an effective and comprehensive pain management plan.